On any given night in Canada, over 30,000 people are without a shelter, a population that has been largely forgotten, believes the director of the Institute of Urban Studies at the University of Winnipeg, Dr. Jino Distasio.
I think the one thing that we know is that there's no single definition in this country of who might end up homeless, what their circumstance might be. Are they living on the streets? Are they living precariously day to day in shelters, living with friends and family, living in ramshackle conditions in old hotels? The homeless population is just so complex that it does require a very complex set of interventions.
He believes that the rise of homelessness is a result of Canada's failure to address the broader social issues of poverty and inequity. He adds that even if it seems like a major undertaking, it is possible to end homelessness.
Well, I think we end homelessness one person at a time, one day at a time, by building one house at a time. We need to provide better care, education, training, support, and we need to intervene much earlier to prevent people from going down that pathway. And we have all the tools that we need right now. We've got the health interventions, we've got the economic interventions, we've got social interventions, but we need now more revenue, more support financially from all three levels of government to invest in all four of those areas.
Offering adequate housing is the first and most important step in the equation. The At-Home Chez Soi program did just that. It helped over 1,000 people find a place to call home. The study also provided some important evidence about the effectiveness of such an intervention.
That was really the first to demonstrate effectively that housing first does end homelessness. And it does end homelessness for a group of individuals who had otherwise struggled with mental health and addiction. And I think what it proved, too, is that you really need to focus in on specific and individualized case management approaches. You can't just have somebody pull a number and put them into an apartment. You've got to really provide an individualized set of services that meets the certain needs of individuals.
On average, providing housing along with a comprehensive individualized intervention plan costs between $30 and $50 per day per individual. The initial investment might seem steep, says Dr. Distasio, but ending homelessness has an economic imperative.
For every person that we get off the streets, we can see savings to the system. So the more individuals that we can end homelessness for is the greater savings to both healthcare, to law enforcement, to social services. And if we can make an investment in somebody's well-being, it's certainly, we feel, money well spent.
Some cities are being pressured into adopting bylaws that limit the use of public space for homeless people. But criminalizing homelessness is not the answer, adds Dr. Distasio.
I mean, there are many instances where we try to fortify space against these types of uses. So whether it's putting rocks under bridges, putting up fences, blaring music, putting sort of articulations on benches so one can't lie down, it all comes back to how do we use space when we have no other space before us. Toronto, for example, has wrestled with this. So how many times can you give an individual a ticket for whatever infraction when you know that they can't pay? Does it really make sense to waste our police efforts on giving tickets repeatedly to people that you know just can't pay a ticket?
So whose responsibility is it to deal with the issue of homelessness?
One of the things that we really need to think more about is how, as a society, have we continued to criminalize poverty and criminalize homelessness? The responsibility, I think, rests with society. At a certain point, we have to come together to find meaningful solutions. I think Canadians would really like to see a day when the headline is homeless shelter closed, not because of funding shortfalls, but because they were not needed. I think that would be a tremendous success.
For Evidence Network, I'm Mélanie Meloche-Holubowski.